101 because FASD is neurodiversity. And let's get right into it because I'm sure you guys have um, quite a bit that you would like to learn about the topic. So, we are a program of the Human Development Center at LSU Health New Orleans. Um, I, Krista James, on the next slide, am the director of FASD initiatives, and also the coordinator of our LEND program. And I also work for a project that we have called LASARD, Louisiana Autism Spectrum and Related Disabilities Project. I started out as a special educator for many years, worked as an autism specialist, and then I adopted my daughters who have fetal alcohol spectrum disorder. And so that's kind of how I exited the autism world and got into the FASD world. Um, I love to travel. I've lived all over the world, and I also love music. And that's one of the things that has really helped me with raising my daughters too, is that shared love of music with them. And so next slide, we're going to talk about in this training, uh, our objectives. So hopefully by the end of this training, you understand the brain differences in FASD and the impacts to learning and health. We're also going to look at what those best practices in the field that support prevention, policy, awareness, and family support. And we're going to understand those best practices to use in home and school community environments. So we have a lot to cover, and this is kind of a condensed version of our full FASD 101 presentation. But if you would like to know more information about FASD whenever we get finished, then please contact me. And at the end, Jolie's going to share my information so that you can be in touch. So let's start off with a little bit about FASD and the brain. FASD is an umbrella term, and it describes the range of effects of a group of disorders that occur when an individual has been affected by prenatal exposure to alcohol. So the symptoms can range from mild to severe, and they affect each person differently. And the diagnosis is based off of particular symptoms. And here's the diagnoses that we have available to us right now. So FAS, which is the full fetal alcohol syndrome, it represents the part of the spectrum that includes those very specific facial features, which are the small eye openings, the thin upper lip, the smooth ridge between the nose and the upper lip, this philtrum area right here. Also includes small stature, and then the neurological challenges with learning, memory, attention, executive functioning, self-regulation, and communication. The next diagnosis that we have is ARND, which is alcohol-related neurodevelopmental disorder. And individuals with ARND may have the same combination of impairments listed under that FAS diagnosis, but with none of those physical markers. The next one is ARBD, alcohol-related birth defects. And people with ARBD can have problems with their heart, kidney, bones, or hearing. Really, when you think about the alcohol exposure, whatever is developing at the time that the drinking is occurring, whatever is developing with the fetus is what's going to be affected. So those could fall under the ARBD, which are those alcohol-related birth defects. And then finally, NDPAE, neurobehavioral disorder associated with prenatal alcohol exposure, is an emerging term that encompasses all of the fetal alcohol-related conditions except for ARBD. And although the range and types of impairments are the same as we mentioned before, It really encompasses individuals with and without facial features, and also that small stature of FAS. So next, we're going to look at the prevalence rate, and we have some new prevalence rates that have just come out from the CDC. So now we're looking at FASD prevalence is estimated to range up to 1 in every 20 school-age children in the United States. So that would be one child in every classroom. And this range is estimated to be higher among children and youth that are involved in the child welfare services system. And thinking about those prevalence rate, it's really difficult for us to get accurate prevalence rates. Many people believe that these rates are really underestimated since professionals often overlook or misdiagnose FASD in kids. And one study found that 86% of foster and adopted youth with FASD had never been previously diagnosed or had been misdiagnosed. And misdiagnosis occurs very often because we have a lack of screening and testing. So alcohol is not something that's typically detected by routine toxicology panels on newborns because it metabolizes very quickly. And then there are lots of inconsistencies in screening for prenatal alcohol and other substance use among healthcare providers. And there's currently no lab test available specifically for FASD. So we also have with FASD a really complex body of symptoms. So children under 3 can be really difficult to diagnose because the deficits in the higher level cognitive functioning often don't occur until they are school age. And FASD can also masquerade as other mental health disorders and behavioral challenges, such as ADHD, bipolar disorder, oppositional defiant disorder, um, autism, and other learning disabilities. And since those facial features are only present in fewer than 20% of individuals with FASD, many times it gets missed because providers are often trained to look for those facial features first. And we know now that most kids are not going to have those facial features. We also know that there's definitely a lot of stigma and fear with an FASD diagnosis. Shame and guilt can prevent women from admitting alcohol use during pregnancy, which can make it more difficult to diagnose. And then also, women fear child welfare involvement or having their children removed from them if they do disclose prenatal alcohol use. And finally, we have a lack of education and training. So professionals in all fields don't receive the education and training necessary to identify FASD signs and symptoms. And we're working really hard at LSU to try and change that and provide some of the information and get the awareness information out there so that families have an understanding of prenatal alcohol exposure, and then also professionals know what to look for. So next slide is we're looking at the biological basis of FASD. So FASD is a result of the effects of that alcohol on the fetus. And because pregnancy lasts 40 weeks and the fetal brain is vulnerable during that entire pregnancy. So any of the common physical aspects associated with FASD occur during that 6-week window in early pregnancy when women might not know that they are pregnant yet. And anytime a woman drinks, the alcohol can influence whatever is developing in the baby at the time. So the effects on the brain could be They could have a really difficult time with abstract thought. They could have trouble linking cause and effect. They may have trouble generalizing skills from one environment to the next. They may have trouble with short-term or long-term memory. They may have attachment disorders, and they may exhibit over-sexualized behavior. So, signs and symptoms of FASD. Um, FASDs, we talked about how it's really that collection of diagnoses. So the signs and symptoms can really have a range, and each person can be affected in different ways. And so one person might have neurological challenges associated with it, which might be poor coordination, hyperactivity, difficulty with attention. They may exhibit some learning disabilities or have some speech language delays. Fewer people with FASD have intellectual disabilities, but we do have some that do. And then more really have difficulty with poor reasoning and judgment. And then on the physical side of that, then they could have low body weight, they could have vision and hearing problems, their heart, kidney, or bones could be affected. They may be shorter than average height, small head circumference, and then they may have those facial features that are associated with full FAS. So when we think about the different disabilities that could occur from prenatal alcohol exposure, we categorize these as primary and secondary disabilities. So primary disabilities are the direct result of the alcohol on the fetus. And then the secondary disabilities are those disabilities that occur after birth as a result of those primary disabilities. And so we're looking at those primary disabilities. It could be the neurological impairment, which could show itself as small head circumference and underdeveloped brain, information processing disorders. So this is where they have the gaps and inconsistencies in understanding sequencing and that auditory processing of information. The memory and attention deficit, they could have spotty or faulty memory or the limited attention span. They could also have language delays, which may result in limited vocabulary and comprehension, or problems with the clarity of their speech or having a speech impairment. And then developmental delays, which may be delayed walking, late talking, or problems with balance, coordination, and fine motor skills. And then those secondary disabilities, which are those that we just said occur after birth, when there's a mismatch between the person and their environment. These can be really challenging for individuals and for the families. And so early diagnosis is really important so that we can get appropriate interventions that can reduce these secondary disabilities. And some examples of these would be mental health disorders, challenges in school, trouble with the law, unsafe sexual behavior, drug and alcohol addiction. We know that the statistics are telling us that 35% of individuals with FASD had severe substance use disorders. We know 60% experienced trouble with the law. 50% experience confinement, which could be in jail, it could be in residential treatment. 61% had disruptions in their school. So that could be a suspension, expulsion, or dropping out. 49% exhibited inappropriate sexual behaviors on repeated occasions. And then 80% could not live independently. So a big part of what we talked about earlier of why we really have trouble getting individuals with FASD diagnosed is really because of the stigma that surrounds fetal alcohol syndrome and fetal alcohol spectrum disorder. Even though we know that most mothers are not drinking intentionally to harm their baby, most mothers don't even know they're pregnant whenever the drinking occurs. And so family support is a huge piece of what makes a person, a family, or an individual with FASD successful. And so I have a little video that I want to show you guys. This will talk a little bit about how to support birth mothers and families out there. So Jolie, whenever you're ready.
Welcome to the NoFast Circle of Hope Birth Mothers Network. My name's Kathy Mitchell. The Circle of Hope is a program designed to prevent future alcohol and drug-exposed pregnancies. We welcome all women from all walks of life that have used alcohol or other drugs while pregnant. I can tell you that to accept that you drank alcohol during pregnancy that resulted in your child having lifelong disabilities and difficulties is a very tough thing to live with. I should know. I have a 37-year-old daughter who has full-blown fetal alcohol syndrome. Little did I know when I was 17, 18 years old and I was pregnant with my daughter that drinking wine on the weekends could result in lifelong problems for my daughter. You know, my daughter Carly was not diagnosed until she was 16. I did not know she was affected when she was born. She seemed perfectly fine. She developed problems as she got older, but nobody ever attributed those to the fact that I drank when I was pregnant. So sadly, I continued to drink in later pregnancies. My fourth baby was born, and he died the day he was born. And I had a beautiful baby girl a few years after that who died when she was just a few months old. They said it was sudden infant death syndrome. Well, today, with the research that's come out, I believe both of those babies died as a direct consequence of my using alcohol during pregnancy. Having a child with a diagnosis of FAS or an FASD, fetal alcohol spectrum disorder, is like wearing a scarlet letter. For the rest of your life, you're kind of in a position of having to confess to the world that, yes, my child is affected, permanently affected, because I drank or used drugs when I was pregnant. You know, before Carly was accurately diagnosed, she had been diagnosed as having cerebral palsy. And when I would run into people in the store and they would meet Carly and ask what her diagnosis was, and I would say cerebral palsy, they would look at me and say, "Oh, bless your heart." And then once she was diagnosed and we had the real diagnosis of fetal alcohol syndrome, and I would say fetal alcohol syndrome, then people would say, "Oh, I didn't realize that you adopted your daughter." And then when I say, "Well, I didn't, I drank when I was pregnant," they run the other way. And that's why I founded the Circle of Hope. You know, meeting other birth moms has really changed my life. The Circle of Hope Birth Mothers Network changes lives, and I believe we help women to stay clean and sober and to move forward from a very painful experience. I get many messages throughout a week from women who are in a lot of pain, living in secrecy and isolation, afraid to tell anyone what's happened and what the real diagnosis is. Women are just so elated to be able to have a place to talk about their grief and remorse about using during pregnancy and to find out how they can help. But you know, it's important to know I have never met a woman who intentionally harmed her unborn child. Every one of our members, you know, simply didn't have the right information. Some have even been told by their physicians to drink while pregnant. Unbelievably, yes, that actually still happens. And of course, some of our women suffer with alcoholism or addiction, and they need treatment. And so we have members, though, that are social drinkers, moderate social drinking, you know, and even fancy French wine can result in having a child with lifelong disabilities. When my daughter, Carly, was diagnosed with fetal alcohol syndrome, it was very isolating. I didn't know one other woman who had a child with FAS. I loathed myself for knowing that my drinking harmed my beautiful daughter. The feeling of guilt and shame and loneliness is exactly what the Circle of Hope is there to help with. Getting together and finding other women to share this common bond with is really healing. The Circle of Hope, we refer to our members as warrior moms because it takes a lot of courage to stand up in public, even to tell your family the truth, to tell your friends and neighbors and communities that yes, my child has problems because I drank when I was pregnant. It's just not an easy thing to do, and it takes a lot of courage. But our members, our warrior moms, believe it's the right thing to do. And the most important thing to all of us is preventing the next case of FASD. We need all the members we can get because united, we can really make a difference. If you're a woman who is drinking or living in isolation or secrecy, you don't have to live this way anymore. We want you to contact us. You can go to our website, nofast.org, find the Birth Mothers Network page. You can email me at mitchell@nofast.org. I can connect you to our private Warrior Mom Facebook. You know, there is hope for recovery out there, and there's people out there that want to help you and want to support you. Contact me anytime, and we can make a difference together.
So, like Kathy said, birth families are really need our support and not our stigma. Um, Jolie, is the PowerPoint shared?
Can you not see it?
I can't see the PowerPoint.
We're on the supporting birth families page.
Okay, maybe everyone else can see it and I can't.
I'll reshare the screen just in case.
And so we want to make sure and consider when we're supporting birth families, because we know that the stigma is out there. There have been studies that looked at kind of those community attitudes towards birth parents. But we want to consider that birth mothers with children with FASD, just like Kathy said, some are social drinkers, some could be alcoholics, some could also have FASD themselves. Many of them are survivors of some form of abuse, and often sexual abuse. And we really have to, with FASD, it's really a whole family support system that we're putting into place. And so looking at those treatments and services, we know that best practice with FASD is early identification and diagnosis, and which is a really difficult in Louisiana right now because we don't have a lot of places that you can go to get a diagnosis for FASD. So that's one of the things that we are working on in LSU right now is providing access for families to be able to get that diagnosis. We also know that engaging in early intervention and special education services is going to produce the best efforts. So getting that referral into early steps so that kids can be seen early on as soon as FASD might be suspected. Getting our school officials trained so that they can implement a really good FASD aware IEP plan for kids in those school system. And then there's lots of family training and support programs out there. Families Moving Forward is one that really focus on helping families and caregivers to be able to provide that support for the kids. And positive behavioral strategies tend to work well with our kids. And then also having a medical home model. So having those wraparound services where everyone on the team is communicating about the child together is what's most beneficial. And then this was done by in a support group for families and children with FASD, and they described their FASD as living every day with a lamp with a short in it, and I thought this was really interesting. They said some days the FASD brain works like a bright shining light bulb. Symptoms are minimal. They are able to do common tasks with little or no help. They remember things they learned with few, if any, difficulties. And then some days the FASD brain's bulb seems to have a short in it. Symptoms come and go. They seem to be misbehaving more. They can sometimes do common tasks and sometimes they can't. Um, sometimes they can't remember things they've learned and forget other things. And then some days the FASD brain bulb seems to have a short in it. Symptoms come and go. They seem to be misbehaving more. They can sometimes do common tasks. Some days the FASD brain bulb won't turn on at all. Symptoms show up throughout the day, and what seem to be misbehaviors are nearly nonstop. Tasks they can often do alone, they now are completely unable to do. They can't remember things that they've demonstrated mastery in the past, and sometimes uh, they can they sometimes remember things they've learned, but then forget other things. And I think as a mom, that very clearly describes what it's like having a child with FASD sometimes. And then finally, we're going to look at challenges in the legal system real quick before I let you guys go. So people with FASD can have a lot of challenges with the legal system. May lead, because they have FASD, it may lead to an increased risk for a range of adverse outcomes when they're unsupported, including involvement in the criminal justice system. So we know that 61% of adolescents and 58% of adults with FASD have been in legal trouble. And 35% of those with FASD over the age of 12 have been incarcerated at some point in their lives. And people diagnosed with or who may have an FASD may encounter problems when dealing with the police, including that they might be persuaded to take responsibility for crimes that were committed by others, consenting to searches of themselves or their possessions, um, panicking during encounters with the police, running away, resisting arrest, saying that they understand their rights when they don't, and making potentially incriminating statements about themselves or about the crime. And so finally, I wanted to close with just a little, I wanted to share with you information about the FASD Respect Act that is um, going through right now our legislature. We know that supporting people with FASD can be incredibly expensive. And so I challenge you to go do some outside Googling on the FASD Respect Act and see, since I know all of you are not from Louisiana, look and see how your state legislators are supporting the FASD Act. If there's any work that you can do to advocate for more supports and services for individuals with FASD in all of our states. And I'm going to stick around for questions. But before you go, if you would please take our survey and tell us if you enjoyed the training, what you learned, what we could do better next time by scanning the QR code. And then Jolie is going to put some links in the chat box for other resources for you to take a look at if you'd like to learn more about FASD. So grab the mic if you have any questions. If not, thank you so much for coming.
Thanks, Krista. That was fantastic.
Thanks, Phil.
And everyone, I encourage you that if you are from, live, or work in Louisiana, please click the link of the last form I just put in the group chat, because we're building an FASD network in Louisiana. We are recently a new FASD United affiliate chapter. And so we're building a team. So if you're interested, if you're a professional, family member, or self-advocate with FASD, let us know by hitting that form about our chapter. Thank you.